We shall also take a look around COVID-19 events that happened across the country in the last 48 hours. Welcome back. Before I introduce the exclusive with our medical expert, let's take a look at the trending stories of COVID-19 in the country, starting from the World Health Organization's warning. The WHO Director General, Tedros Adhanom Ghebreyesus, didn't specify why he believes the outbreak that has infected some 2.5 million people and killed over 166,000 could get worse. He and others, however, have previously pointed to the likely future spread of the illness through Africa, where health systems are far less developed. Trust us, he said, the worst is yet ahead of us. Tedros told reporters from WHO headquarters in Geneva, let's prevent this tragedy. It's a virus that many people still don't understand, he said. Some Asian and European governments have gradually eased or started relaxing lockdown measures like quarantines, school and business closures, and restrictions on public gatherings, citing a decline in the growth of COVID-19 case count and deaths. Tedros and his agency have been on the defensive after President Donald Trump of the United States, the WHO's biggest single donor, last week ordered a halt to U.S. funding for the agency, alleging that it botched the early response to the outbreak, among other things. Trump insisted WHO had failed to adequately share in a timely and transparent way information about the outbreak after it erupted in China last year. Tedros said, there is no secret in WHO because keeping things confidential or secret is dangerous, is a health issue. This virus is dangerous. It exploits cracks between us when we have differences, he said. Tedros said U.S. Centers for Disease Control and Prevention staffers have been seconded to work with his agency, suggesting that was a sign of WHO's transparency. Having CDC staff at WHO means there is nothing hidden from the U.S. from day one, Tedros said. Our CDC colleagues also know that we give information immediately to anyone. In one of his starkest comparisons yet, the UN Health Agency chief also alluded to the so-called Spanish flu more than a century ago, saying the coronavirus has a heavy, dangerous combination, like the 1918 flu that killed up to 100 million people. Tedros called the illness public enemy number one and said, we have been warning from day one. This is a devil that everyone and everybody should fight. And then we move on to another good story making rounds in the country where the federal government had to apologize to the country over the conduct, the protocol lapses at Abba Kyari's burial. The federal government apologized 2 days ago for the lapses and the violation of COVID-19 safety principles and protocols that occurred during Saturday's burial of the Chief of Staff to President Muhammadu Buhari, Malam Abba Kyari, in Abuja. It also cautioned Nigerians against undue optimism over when the COVID-19 pandemic would end, assuring them, however, that it was striving to overcome the virus, which cases rose to 665 in 2 days' time, with about 188 patients discharged, while 22 persons dead so far. And the federal government said as part of the renewed efforts to combat the pandemic, it had developed a new action plan to tackle the spread of the virus, adding that it would evacuate Nigerians living abroad by next week. Besides, the federal and state government yesterday gave updates in their effort at combating the virus, with Edo and Ondo State announcing the discharge of their index cases, while Lagos State said from next week it would make the wearing of face masks compulsory in the public. Meanwhile, no fewer than 8 private hospitals have suspended operations in Lagos for 2 weeks, apparently to allow for the rectification of their facilities after treating COVID-19 patients, in some cases unknowingly. At a press conference in Abuja, chairman of the Presidential Task Force on COVID-19 and Secretary to the Government of the Federation, SGF, Mr. Boss Mustafa, and the National Coordinator on COVID-19, Dr. Sani Aliyu, apologized on behalf of the federal government to Nigerians over the lapses at Kyari's burial. Mustafa listed some of the violations which the Presidential Task Force had regrettably observed, to include failure to follow the guidance provided on mass gatherings, social distancing, personal hygiene, and restriction of movements. The PTF recognizes regrettably the unintentional violation of the principles and protocols that form the core of our messaging to Nigerians at the funeral of the late Chief of Staff. These principles for emphasis include the guidance provided on mass gatherings, social distancing, personal hygiene, and restriction of movements. Lessons have been learned, he said, and appropriate measures have been taken to close all gaps. We assure all Nigerians of their safety and the determination of PTF to combat the pandemic, he stated. Mustafa added that the development had renewed the resolve of the task force to remain focused on the response to COVID-19 in honor of the late Chief of Staff and other diseased patients. On the call that all members of the task force that attended the funeral should self-quarantine, the SGF said, "I want to assure Nigerians that we are responsible people with family members. We have children, spouses, and our friends like you. We won't do anything as a PTF to put you at risk." That was what the SGF, the Secretary to the Government of the Federation, Boss Mustafa, said as regard their own measures to curb the COVID-19 pandemic. Meanwhile, FG has also insisted that corpse of COVID-19 victims could not be infectious. Ali also apologized to the public for the blunders at Kyari's funeral, which had put the FCT residents at the risk of the contagion. He said lessons had been learned from the experience. Ali said the burial ground had been decontaminated, while the protective equipment of one of the undertakers that was dumped at the site had also been decontaminated and discarded according to the NCDC guidelines. Contrary to the allegations in the social media, Kyari corpses was properly prepared for burial according to NCDC guidelines. At this juncture, let's get to watch the exclusive with Dr. W.H.O Ogbonnaya, a family physician, to speak to us about the prediction of the World Health Organization and possible solution to COVID-19, as it has been uncovered that the pandemic is not a death sentence after all. Yeah, on Spectacle today is a consultant family physician, CFP, Dr. W.H.O Ogbonnaya. Welcome to Spectacle.
Thank you, Daniel.
All right. He's a medical director of a prime care hospital, Gwarimpa, in FCT here. Doctor, you heard the prediction or the statement of the WHO boss in the person of Tedros Adhanom Ghebreyesus, predicting that the escalation of the coronavirus pandemic will be much and severe in Africa. What do you think prompted this prediction or presumption?
All right, thank you very much. His prediction is not out of place, first and foremost. I know WHO has been like in the forefront of health, protection of health all over the world. That's actually their basic, their watchword. Now, they are not just involved in researching, they're also advisory, and as much as possible, they help to develop policies, health policies that are uniform, standard all over the world. Now, somebody as eminent as the Director General of WHO, Dr. Theodoros, to come up with such a statement is worrisome.
Okay.
Now, why it is worrisome is because there is actually a precedent. Probably he has been following a trend. He has been following that made him come up with such a prediction. Africa, for some time now, has been in the front runner, even before the onset of coronavirus. You know, where you have issues to do with poor health management, poor healthcare services. They have over time refused to improve their healthcare delivery system. They have over time refused to dedicate the minimum percentage of the budget that has been supposed to be exposed to healthcare. It is a place, it is a part of the world that is bedeviled, riddled all forms of diseases, poverty, ignorance, sickness, corruption, and all kinds of lack of political will to improve the situation on ground. Now, the leadership in Africa as a whole has failed, in the sense that they have refused to muster the necessary political will to improve the quality of healthcare over time. They are more interested in fleecing the wealth of their countries. Now, that has put us where we are, where we're talking about absolutely very poor healthcare management.
So all the while, you mean the percentage from the budget has
never met the standard right from the inception. We're not just talking about Nigeria now, we're talking about all over Africa.
How many percent should
now,
be?
WHO puts it at between 5 to 10%.
Okay, of the national budget.
National budget.
Into health.
Now, you can be sure that a lot of us, you see a lot of places where you see some governments are dedicating just 1% of their budgetary provisions to health. Now, with that background, WHO is very correct. That's why I said his assertion is not out of place. Now, he is looking at a situation whereby very highly developed nations, medical resources and all whatnot, like you have in the first world, the developed countries, they are presently reeling under the effects of coronavirus. You have a situation whereby I'm talking about over, like in the United States, where like we always like to use as a pointer, you have over 799,000 infections and over 42,000 deaths in record time. Now, we are looking at a situation whereby a country like that, which we always want to use when we are comparing standards, if a country like that, coronavirus could put them to shame, literally speaking, with all their technological know-how in the medical field. Now, one now ponders to understand what will happen when corona comes into full force in these other countries, African countries, the so-called developing nations, where we have just mentioned the ills. In addition, we're talking about poor political will. We're also talking about where you have overcrowding, poor housing facilities, and so on, illiteracy, poverty, hunger, and so on and so forth. Now, you are looking at a situation whereby if this kind of sickness, which we know how easily it is transmitted, it's not like other sicknesses that you really have to go out of your way to get infected. Talking about the other viral components.
Yes.
This one can easily be spread by as much as respiratory droplets. Okay. You don't have to have contact literally with the person. You don't have to exchange blood with the person, just respiratory droplets, which can easily be spread even by talking. Now, to tell you, if it is that easily spread, so one can now imagine with all these indices we've mentioned in these African countries, the preceding indices we mentioned, what the effect will be. So that's why I don't think Dr. Theodoros is out of point saying such statements. It should actually be a wake-up call to the leadership in most African countries.
Okay, and now so far across the world we have recorded about 2.5 million infection across the world and about 166,000 death, out of which US shares the lion's share right now.
Yes.
And China, Italy.
Yeah.
Do you see that despite this lockdown, do you still see the possibility of the spread like the WHO director is saying?
Yeah, the fact is there is a lockdown. by pronouncement, but in reality, is it actually a lockdown? So that is actually the question I will want us to answer. Now, His Excellency, the Commander-in-Chief, in his own wisdom, has announced a lockdown. This is actually the third week. Now, we are looking at 3 states were actually involved by the federal government. Talking about FCT, talking about Lagos State, and Ogun State. Yeah. Now, other states have also introduced their own levels of lockdown. All right, more of like preventary, but those ones are from their own state governments. Now, the question is, if you take a cursory look at these states in question, FCT, for instance, where we operate in, now you go around. A lockdown is supposed to be, in ideal climes, lockdown means there is no movement, there is no interaction, there is no contact, there is enforced social distancing. Now, while these things are going on, people are also encouraged, apart from essential services, which have been widely stipulated. Now, while these lockdowns are also going on, the government is also supposed to play their own part to encourage these individuals to also observe the lockdown itself. Now, they are supposed to, as much as possible, come up with palliative measures, all forms of food relief and so on and so forth. Well, I'm sure we are still going to get there very soon. But the fact is, the lockdown as presently is in Nigeria we still have a long way to go. So a situation whereby we say there's a lockdown and you still see people, okay, probably there's a reduced in vehicular movement. Now, how about people who are strolling? Are they not under lockdown? If you drive along the road now, along our roads in FCT, you see a lot of human movement. Now, the problem we have at such a situation is we think there's a lockdown. But now, these people are still moving. At any point, any time of the day, it should have been a total thing. They move during the morning, in the afternoon, and at night. Some are in the guise of exercising. Some are, jogging together, holding hands. There is no social distancing. So that's why my fear in that scenario is that the lockdown, yes, being well-intentioned as it is, the government has a good intention by so doing. But now the implementation is still not 100% as we expect it to be. Now, in the city center, you could see some level of compliance, which is commendable. Apart from the human traffic, the movement we're talking about. Now, if you go to the suburbs, places like Lube, places like Nyanya, Maraba, you will see that there is little or no compliance. So the question now is, even if you are achieving some level of control, flattening of the curve in the city center, what happens in the suburbs? Are these not Abuja? So that's why one will still not be surprised that these rates will keep increasing, even with the lockdown.
And do you think that what W.H.O is saying is a coincidental statement with that of Bill Gates and Melinda Gates, especially predicting much death in Africa? Then I will now ask you to tell us more about the contagious nature of COVID-19 that we are so much afraid of, that the whole world is locking down.
Okay. Thank you very much. The statements, even though I know a lot of people are really meaning into it, the statements are still valid. Whether from Bill Gates, from Melinda Gates. I've been reading about some on social media, people who have been talking about involvement of Bill Gates in getting vaccines that will reduce the population. Well, I don't think with the kind of level he occupies in society, especially in the international world, I'm not sure Bill Gates will actually subscribe. This is somebody who is a lot into philanthropy, improvement of health indices. I mean, his foundation, the efforts they are making, especially to eradicate polio single-handedly. So I still want to disbelieve such assertions. People trying to ascribe him with such negative connotations to a statement is made, which are ideally statements of facts. So before we become emotional, because we become sentimental in interpreting such statements, we really need to understand the import. We need to understand where we operate from, the continent we find ourselves, the indices we are battling with, we are grappling with, which over the centuries, over the decades, have not simply improved. So I think anybody who is making such statements, instead of us to call for his head, it should be a wake-up call for us to look inwards and then decide after the after the COVID-19 must have been eradicated finally. Decide that enough is enough. Let us move from where we are, instead of being the laughing stock of the world, and we have what it takes. We have the potentials, economically, manpower, whatever you want, whatever you mention, however you want to go about it. We have the manpower, we have the potential to be up there with other parts of the world. So I think in this low period of Africa, this is time for us to go inwards, do some level of introspection into those statements instead of being sentimental about them, and see how we can improve on them. Be more oriented, science research oriented, be more concrete, more concrete and abstract thinking. I think that will take us to a higher pedestal than for us to always want to be the crybaby. We play that victim mentality that we always do.
Back to the second question. The contagious nature of this COVID-19. I hope you are aware of it.
Yes.
And what tell us more about this COVID-19 that is spreading exponentially and in geometrical progression?
Now, coronavirus has always been with us, right from time immemorial.
Has always been with us.
Has always been with us. But the particular strain we call COVID-19, the one causing the COVID-19, actually the real name is supposed to be SARS coronavirus 2.
Okay.
Now, SARS there meaning severe acute respiratory syndrome.
Severe acute respiratory syndrome.
Coronavirus 2.
Okay.
That's the one that is responsible for the particular one we are having. We have had other SAR viruses before.
SARS virus, like MERS.
The one we had before, and the one. But just that the only issue with this one is it is a new virus. Other ones have been known over time. Vaccines developed, treatment developed, very much understanding had about them. But this one was first discovered somewhere in China, 1st of December 2019. First discovered. In fact, that was why they now call it the novel standing for new.
Okay.
Coronavirus. It has not been known to mankind before now.
So what is new about it?
Now, the new thing about it is just like others who cause severe acute respiratory syndrome, the difference now is that it's more virulent. In other words, it causes more morbidity and more fatality. Then two, much information is still lacking. Much information is still not known about it.
But much solution has been recorded in China.
Now, China, China, we also have to understand China from the context of their communist lifestyle. Okay. China, up till now, we have still not come up with what exactly China did. Now, a lot of assertions have been made. A lot of people have mentioned the use of antiretrovirals. They are employing antiretrovirals.
HIV drugs.
Yeah, antiretrovirals. Okay. All right, they're using to achieve cure. Some also mentioned the place of hydroxychloroquine.
Okay.
Now, but the truth is that the Chinese, because of their background, the communist background, have not actually come out clearly. This is what they did. Now, all we are just saying are all, how will I put it now, are all, we are just predicting, we are just, now speculating, all right, that this is what the Chinese did. But China has not come out clearly, this is what we did. But the fact is that they employed a lot of things.
Okay.
A lot of things, including from some local Chinese herbs. Okay. But I'm sure with passage of time, because now what they're now doing is
local Chinese herbs.
Yes.
Anyway, after this short break, we'll continue from where you stopped, Doc.
All right.
Let's take a break a bit. Stay tuned.
Quite alright, the gloves play very important roles in clinical settings, but there is little widespread of evidence that they are used to the members of the public. It may also come as a surprise, but recently, doctors in the United States and other healthcare providers say wearing gloves won't give you an added layer of protection against the risk of coming into contact with germs. Most experts say a pair of gloves won't lower your risk of contracting COVID-19, mostly because wearing gloves provides a false sense of security that bare hands do not. People often don't understand that a glove could transfer germs to any and all surfaces that touch. Take for instance, handling your phone with the same hand gloves that has been exposed to germs and still use the phone afterwards to receive a call, thereby coming in direct contact with your face. COVID-19 doesn't transmit through skin contact on your hands, but rather bacteria and viruses enters your system through mucous membranes on your body, that is, the eyes, the nose and the mouth, or via respiratory droplets in close proximity. Conclusively, the hand gloves are not designed for prolonged use or daily use, but if you must use one, wash your hands with soap and water or use a hand sanitizer afterwards. Remember, spread the knowledge and not the virus.
Welcome back. You were saying that China employs so many alternative drugs,
Yes.
like the herb, and they one time introduced to us that they've introduced Avigan and Favipiravir. I don't know whether it is their own herbal drug.
No, it's not. It's actually just the antivirals we talked about.
Oh, okay.
It's a mixture of ritonavir,
Okay.
and I think Aluvia and one other antiviral,
Okay.
all right, which they employed, which as much as possible helped in decimating the virus. But it's also important to note at this stage that apart from the drugs, they are also in play. They also employed plasma extracts
Okay.
from recovered patients.
Okay.
All right. They also use them in achieving cure for some of these some new cases. So, like I said,
What is the plasma substance?
no, it's just plasma from patients that have suffered and recovered.
Okay.
So they usually come up with a lot of antibodies and stuff. They have a lot of antibodies. So in other words, those antibodies, some of them are killer antibodies, natural killer cells and stuff. So when you introduce it to a patient that has coronavirus, it already understands what coronavirus is all about. It goes to fight, it goes to kill, and most of them actually recover from such infections. I'm sure that was what Governor Makinde in Oyo State, that was what he was sitting for. That he said he was ready to donate his blood to aid in treatment of coronavirus.
Okay.
Because probably I'm sure he was aware of that piece of information. Okay. So that's why he volunteered after he has recovered to use his blood for.
So you people that are medical doctors that are private owned institutions, medical hospitals, when are you expecting the FG and the Ministry of Health to induct you into the treatment of COVID-19?
Well, it's very controversial. Private hospitals getting themselves involved in management of coronavirus sickness.
Don't you think it will speed the recovery rate?
No, the question now you should ask yourself is how many private hospitals are equipped? It's not just all about knowledge. Like some people say there is no emergency in a pandemic. Now, there's no bravado in medicine. Now, you don't go into something which is very fatal. You don't go into managing any sickness which you are not prepared for. How many of these private hospitals are equipped? How many of them have the requisite protection, the PPE protective kits?
Yes.
How many of them have it? Well, I'm talking about the full scale.
Yes.
All right, the full measure. We're not talking about just having the overall
protective equipment.
Very good. How many of them have that complete for all their staff? How many of them? Now we're talking about even places where government is funding, still complain of lack of the PPE kits. So that's actually why I said it's controversial. It's not about approving, but won't it cause more fatalities? Now, because now the medical personnel, you need them to be in the field. You need them for every medical doctor, every medical personnel. Let me not personalize. For every medical personnel that is lost, a lot of the medical world has lost a lot of experience, has lost a lot of contribution that he otherwise would have added. So that's why ideally we do not subscribe to loss of any medical personnel, because we know the effect it's going to have on the system. So that's why we will rather encourage that if private hospitals are not empowered, are not ready, are not prepared, as the case is, let us continue our practice, what is going on, which rightly the federal government is also in support, that the treatment should only be limited to places that are authorized.
Okay.
Isolation centers where those things have been provided.
Okay.
Well provided, the staff motivated, all right, and then all kinds of care, where from primary to secondary to tertiary, of those patients are also available. So I think there is no room yet now for private medical practitioners. Okay,
good. But judging from the rate at which it's spreading now, Kano State just recorded about 38, to 58 high cases, and they are also investigating some death. We don't know whether it's as a result of COVID-19. Judging from the rate at which this thing is spreading, do you think that any possible alternative drug could be introduced in this part of the world, like Nigeria, so that we can cushion the effect?
The problem is that even the drugs we mentioned earlier on, that China has come up, and I'm sure you are aware, recently, I think it's a university, one of those universities in the US, I think it was Florida, also published their findings on ivermectin. That's a drug that we have earlier been known to use to treat ivermectin, that mectizan. Okay. The effects, how the beneficial effects of mectizan on the coronavirus. But these are actually what we call in vivo studies.
In vivo studies.
That's in a laboratory. Okay. So now they're actually trying to see how they can extrapolate that into outside the laboratory. Okay. Will that also have good effect? Now the question about all these medications we mentioned, some people have mentioned vitamin C, some people have mentioned hydroxychloroquine, some people have mentioned azithromycin. Now the question now is, even though FDA has kind of allowed us to use it, all right, now it doesn't mean it has been approved, officially been approved for treating coronavirus. Now, but the only thing now is that because of the effect, because they're also looking at the side effects of these drugs. Now, they're now looking at if these drugs are employed in treating coronavirus, you are still not convinced that it is giving the right improvement, the right treatment to those patients. It's just the figures that are coming out are just sporadic figures, not like they are settled. They are sporadic from particular different treatment centers. This person say I use this and got this so result.
Depends on the immune system.
Depends on the immune system. All right. Now that's why they are not very specific. You can't come out just like you can say Coartem is for malaria. You can't come out clearly and say these drugs are for coronavirus, because they have not been established. Both the potency, the universality of these drugs, as well as the side effects, especially when employed at such doses for such time. So I think those are the things FDA is studying at the moment before they finally make a pronouncement. But for now, they gave a provisional endorsement, but not an approval for it to be used. So that's why nobody can.
What is the quantity of usage they gave?
Okay, like I think hydroxychloroquine was given as 200 milligram twice a day.
Twice a day.
All right. While azithromycin was given as 500 milligram daily. Azithromycin 500 milligram daily. Now you can also introduce vitamin C into the mix, 1,000 grams. So those are actually what some studies, some centers used and got effects. Now, we have not been shown that these are multi-centric results.
Okay.
So until they become universally beneficial in different centers, before one can stick out his neck and say, yes, we have found the cure. That's why the world is still battling with the effective cure.
Okay.
The cure that will be universal.
Okay. In that case,
Yes.
could we, in this part of the world, alternate for herbal drugs?
Yeah, why not? Because as far as I'm concerned, what are herbal drugs? Even the paracetamol you use, even the quinine you use, the anti-malarials you use, all these drugs we use, I don't know herbal drugs.
Okay.
They are all extracted primarily from herbs.
Okay.
Before they were not developed and studied and the chemical components understood and packaged and compounded into drugs that we now swallow as paracetamol or whatever the name is. The problem with our own practice here is that our herbs here have not been refined, have not been extracted, have not been understood. People just walk into any farm, pluck any leaf and tell you it does this. Yes, it could do this, but nobody has actually bothered to know what are the effects, after effects. Are there other challenges that herb can pose? All right, let me give you an example. Like the quinine we all hear about,
yes.
Which was developed from, I think, cinchona alkaloids,
Okay.
in somewhere in Peru, some centuries back. Now they were using it for treatment of malaria. Then it wasn't quinine; it was just from the bark of a tree.
Okay.
Now they were using it and it was working for malaria. It was treating them for malaria, but they didn't know what it was.
Okay.
All right. Not until science came in and harvested that same tree, that same bark of a tree.
Okay.
Now, when they now studied it, quinine was extracted. But you know the funny thing? After quinine, other things also came up. Quinacrine was there. Quinadine was there. And a lot of other quinine-related components. Now, some of them have effects, have what we call arrhythmic effects on the heart. They can actually shut your heart down. Now, if science did not come in and separate them individually, probably we wouldn't have been able to know that quinine does this, quinadine can do this, quinacrine can do this. So that's actually the beauty of science. So we are looking at a situation whereby if we are going to promote our herbal medicine, which I don't have anything against, we should be more clinical about it, we should be more strategic about it. We should be able to take this into a lab, understand the components, and not just call it any name, any arbitrary name, hibiscus flower or whatever. Isolate the components, chemical components. So can I tell you?
Does NAFDAC do that before they approve drugs?
Well, NAFDAC approved those drugs based on probably one or two factors which I may not be privileged to know at the moment. But the fact still remains, we need to do more on those drugs. We need to do more, not just approving drugs because they are called herbal supplements. If you carry up any of them and look at the components, quite unlike your contemporary drugs, orthodox drugs, that for instance, if you carry, say, paracetamol, Panadol, you see the components. They tell you paracetamol, acetaminophen, they tell you other excipients. You now know, as a doctor now, you can predict, I can give you this is what it will do to you for so and so day, because you understand the components. The problem with the herbal counterparts is that they don't have this quality. They're not able to tell you the components. Instead of mentioning names of trees, they'll tell you hibiscus flower is inside. They tell you chrysanthemum flower is inside it. What do you know about chrysanthemum? Are you a biologist? How will you know what is contained in it? What chemicals are inside of it that should be able to do this and that? So I think that still remains the challenge of herbal medicine. So if we are going to develop herbal medicine, I don't have any issue with that. All right, it would definitely, like at the moment, this is one of those periods that WHO calls, can actually put drugs or even put whatever agent diagnosis kits as what we call emergency use listing. Emergency use listing means if it's going to do the job, why not use it? But study is still going on. On a large scale, but can you still use it to do what you say it is doing? So, for instance, if anybody is able to develop such medications and want to use it on a small scale, in his community, nobody will really stop you. All right, because of course you have to do the right thing. alert the authorities, let them register it under the EUL listing, all right? And then you can, at that stage, now call for more studies on it so that people can understand what it is, what exactly chemical is there, what name, is it methicillin or is it chloroquine inside it, whatever it is, and then we can now call it a name and be able to manufacture it in large quantities in the lab. All
right. Doctor, in your last word, COVID-19, from the perspective you view it and its activity, do we have hope of getting out of it sooner?
Definitely. There is hope, but not soon. Now, what do I mean by not soon? Because now, drugs are still being developed. Vaccines are still being developed, are still passing through trials. Now, the one that has been developed by some two French scientists now has become the object of political struggle.
Okay, over this COVID-19?
Yes.
Vaccines?
Yes. Vaccines were developed by two French scientists.
Two French scientists.
Now, but they now insisted that they want to try it in Africa.
Okay.
Among blacks.
Okay.
So, of course, all African celebrities, Samuel Eto'o, Didier Drogba, and all of them now rose against it. Of course, you know what it means. By the time celebrities came up, of course, the government also joined.
Yes.
Now they now said, why don't you try it with the whites?
Try it on animals.
No. Of course, they have gone beyond the stage of animals. Now we're talking about human trials. So why not? Why will you emphasize on blacks? Now they have their reasons why they want to talk of, why they are trying to use on blacks. They are looking at those things we still mentioned earlier, those indices, overcrowding and all that, how easily it spreads. So that's really why they said it's better to test it here, where the health indices seem to have failed, than testing it where you cannot really follow it properly. So I see the point. So that's why sometimes we may need to look away from sentiments.
Okay.
Sometimes we need to look away from emotions.
Okay.
All we are looking for is solution. Now, they are saying that the earliest, back to your question, they are saying that the earliest, even when these trials are conducted, the earliest we are looking at is probably in the next 18 months when a proper, effective vaccine will be developed.
Okay.
Now, we are saying, okay, in the interim, is it also possible while we're developing the vaccines, developing the drugs, can we also use these practices, lockdown, hygiene, and so on, so to flatten the curve, to break the chain? That can also go a long way. So that's why I think it's, after all, there was a similar disease like this that caused a lot of panic and fear. Ebola. I'm sure you remember Ebola.
Exactly.
Now, where is Ebola? Ebola has now become a regional disease somewhere in Zaire.
Yes.
Today is no more widespread as it used to be. So some experts are also looking at, even if the drugs don't come out, now with these practices we are doing, one day you can also consign corona.
Before I forget, Doctor, the vaccines, have they named the vaccine developed by the two French scientists?
No, I don't really know the name of those vaccines.
Okay.
But if you go online, you'll see the controversy is always generating.
All right.
It's always generating a lot of.
Well, thank you very much, Dr. Iheme Ogbonnaya.
Yeah,
so when am I going to have you on Spectacle to take us to your hospital and your properties for advertorial? You are too good, and I think the government will need your service.
Well, I'll be open to consult for the government, especially on this coronavirus, whenever I am needed and wherever I'm needed.
All right. Yeah, I will meet you soon. I'll be with you soon.
No problem.
We'll discuss the modality.
It's all right.
All right. I've been speaking with Dr. Iheme Ogbonnaya. I've been speaking with Dr. Iheme Ogbonnaya, a family physician and a medical director with the Prime Care Hospital. Thanks for coming.
My pleasure. Anytime, any day.
Thank you.
This is where Spectacle will.
And this is where, of course, Spectacle will stop today on Television Nigerian. Please do ensure you follow us on our social media platforms. Twitter, YouTube. At Twitter, we are at TV Nigerian. YouTube, Television Nigerian. Facebook, Television Nigerian. Instagram. And don't forget to follow us on our live stream at tvn.news. Thanks for watching, and I'll be your host, Daniel Atai. See you tomorrow. Welcome to Spectacle on Television Nigeria. I am your host, Daniel Atai. Welcome to Spectacle.